2018 is in many ways a year of milestones. This is the 40th anniversary of the onset of the Iranian Revolution. It is the 10th anniversary of the election of Barack Obama to the presidency of the United States, the first African American to ascend to the highest office in this land. In Catholic terms, this year will bring the 5th anniversary on March 13th of Pope Francis's election to the papacy. And yet, in Catholic conversation, probably the single biggest milestone of this year is the 50th anniversary of Humanae Vitae, that landmark encyclical from Blessed Pope Paul VI, set to be made a saint within 2018 by Pope Francis. Now, that encyclical was a broad treatment of human population, of the meaning and purpose of marriage, of the inherent dignity and the moral beauty of human sexuality. In popular parlance, however, it is best known as the document which reaffirmed the Church's traditional opposition to artificial birth control. Humanae Vitae unleashed massive discussion and controversy 50 years ago. It continues to unleash discussion and controversy 50 years later. One of the most important events marking this 50th anniversary of Humanae Vitae is being sponsored by the National Catholic Bioethics Center in the United States. And with us to discuss it is Dr. John Brehany, the Director of Institutional Planning at the NCBC. John, thank you so much for being with us.
Well, John, it's great to join you this morning.
So, listen, talk to us about this event you have coming up on Humanae Vitae. Of course, 2018, because of the milestone, there are lots and lots of events. I am speaking to you here from Rome. Rarely does a week go by this year when there isn't something connected to Humanae Vitae that is on the calendar. And, you know, with lesser frequency, that's true in many parts of the world. So talk to us about this specific event and kind of what sets it apart.
Yes, our event, which is scheduled for October 11th through the 13th in 2018, is unique. I've seen a list of the events going on in the United States. There are at least 15 to 20 done by dioceses, done by universities. I think ours is unique for a couple of reasons. First of all, it's national in scope and not institution-specific or regional. Second, it's interdisciplinary. We have a range of major institutions from Catholic healthcare systems to a university, to an archdiocese, to the National Catholic Bioethics Center. So it's a unique group of sponsors who have come together. It's a very practical conference in some respects. There are some great conferences out there that go back over the ground of philosophy and theology. Ours is focused on healthcare delivery. How do we make healthcare consistent with the principles of Humanae Vitae and, of course, all of Catholic moral teachings? How do we increase the total amount of that care? How do we improve the quality of that care? How do we offer it to people more effectively? And it's very positive. You know, we're going to be there not so much to review the problems with secular approaches or some of the negativity, as you mentioned, or the controversy. We're there to say who's out there doing excellent work, really, I would say, in transforming healthcare, and how do many Catholics work together, especially in the healthcare field, whether they're individuals or institutions, or universities who provide education to advance the principles of the encyclical.
So, John, you mentioned the various sponsors who are behind this effort, and you talked about what makes this unique, what sets it apart from other events. But I'd like to have you talk a little bit about what do you think the sponsors want to get out of this? What are their aims in putting this thing together? Since there are so many other events going on, what do you think the sponsors believe this event uniquely can achieve?
Yeah, that's a great question. And let me just mention the conference website real quick for anyone who wants to see the list of sponsors or other materials. It's HV, that's HV for Humanae Vitae, hvandhealthcare.com. So you can check it out. I'll say a quick word. Let me list off the sponsors. In healthcare systems, we have Ascension, which is the largest Catholic healthcare system in the United States, and I think indeed the world. We have a Mercy, healthcare system in St. Louis, a couple of Illinois systems, Franciscan Alliance and OSF Healthcare. And then we have two in the Northeast, Catholic Health Services of Long Island, which pretty much serves Long Island, and Geisinger Holy Spirit, a system in Pennsylvania. So those are the healthcare systems. Joining them are the National Catholic Bioethics Center, the Archdiocese of St. Louis University, and a Guild of the Catholic Medical Association in St. Louis. So again, it's a unique group of sponsors who are either obviously involved in healthcare delivery or in education in key respects. And we're going to hold it on the grounds of St. Louis University on October 11th through the 13th. You know, the goal of the sponsors, in a very literal sense, is to commemorate Humanae Vitae. Everyone is sponsoring because they think that there is a substantive teaching there. It's of great significance and it's life-giving. And so we think that the best way to remember it, in a way, is to talk about how do we advance its core principles, which are really needed in the world today. I would say it's about evangelization in the deepest sense, wanting to share our experience of Christ and his church and of the moral witness over 2,000 years, not proselytize, but evangelize in a very deep sense. And really, I think it's about improving the healthcare of human persons. And there's a lot that the church's moral tradition and teaching in this regard can do to serve that goal.
Now, John, you know, in the nature of my job, as somebody who covers the Vatican and who covers the Catholic churches, I go to a lot of conferences, you know, more than my fair share. And I get promotional material for conferences all of the time, literally every day of the week. And usually the way I try to evaluate whether a particular conference is worth my time is not only the topic, but more concretely, who are the speakers, right? I mean, who's actually going to be talking at this thing? And do I believe they're going to have something interesting to say? So can you just step through for us, like who some of the major speakers are going to be at this thing and what you expect them to have to say?
Well, you know, one thing I'll say about this conference, and I know there's another in April at Catholic U that has some big names from the world of academe. We don't really have a big name theologian or philosopher, but what we do have are a wide range of Catholic physicians, healthcare administrators, and educators who are really out there implementing this teaching, doing the scientific research, collaborating with a wide range of people to offer the teachings on a daily basis. So yours truly, I will be speaking about the encyclical itself, recalling its history, its key points. I am a graduate of the John Paul II Institute for the Studies on Marriage and Family. We have a wonderful physician named Marguerite Duane with a team of people who is going to present an overview of the different methods of, we don't really call it natural family planning or NFP anymore, but we call it fertility awareness or appreciation methods. She has a great organization called FACTS, Fertility Appreciation Consortium to Teach the Science, and that's what she does on a daily basis, is advance a professional, research-based, and really a multi-organizational effort to teach this as a science, as a contemporary tool to help women in particular. We have leading doctors who have been practicing for years in this field. Two of them are practicing within Catholic healthcare systems, Mercy and OSF Healthcare, that really have an integrated system-based approach to advancing this teaching, to advancing education, to advancing surgical services, benefits, healthcare benefits. So we have Jillian Stallings from OSF Healthcare and Gavin Putoff from Mercy Health, and a couple of other physicians who have been in individual practice Paul Carpentier, who's now with Catholic Health Services of Long Island, and Stephen Hilgers, who's the son of the renowned Dr. Thomas Hilgers, who's done so much to advance the field. We're going to be having educators as well to talk about how do we advance this in professional education, whether it's in med school or residency. And then people who are out there promoting this and partnering in unique ways. We have a couple of people, one from Mercy Health, an administrator, Jared Bryson, who works for Mercy, who works with the Archdiocese of St. Louis. We'll have Diane Daly talk about how they partner in that region to improve services. And Ann Nolte, who has an effort called the National Gianna Center, which is really trying to rebrand how what we call, again, fertility care services are being offered. So those are some of the names. I think what people should take away is this isn't going to be academic. It's not going to be theoretical. These are people who are doing excellent work in the field and will be able to tell people this is what's going on. You know, we don't get our good stories out often enough. And this is how you can do it too. And this is how it serves patients in a very positive way.
Can you just tell me briefly, who's the intended audience here? That is, who should attend this conference?
Yeah, we're looking for, I would say, 3 sets of people. Of course, anyone interested, but we especially want to draw healthcare administrators from across the United States. I mean, we have a great start with 6 Catholic healthcare systems. We're going to be reaching out to others because to offer something in healthcare today takes a programmatic approach. So we need administrators to come and learn how to do it. We're looking for healthcare professionals, physicians, nurse practitioners. They might be in leadership positions in Catholic healthcare, chief medical officer, things like that, or just working within Catholic healthcare systems. So we want them to come and hear and learn and discuss. And then we'd like to draw people from dioceses across the country because those partnerships between institutions like hospitals, healthcare systems, with skilled and trained individuals, and then dioceses and the network that brings, we think is crucial to enhancing efforts to get these services out. So those 3 classes of people, and whether someone's with an institution or just out there working in the field, would welcome all those people.
All right, well, you heard it here. If you are looking for a fascinating and informative way to mark the 50th anniversary of Humanae Vitae, unquestionably one of the most important and consequential papal documents of the last century, probably. You can find it through the National Catholic Bioethics Center. Dr. John Brehany just gave you the web information, so you can find it all on that website. It would really be a remarkable opportunity to bring yourself up to speed about the best contemporary discussions about both the theory and practice of Humanae Vitae. This has been an exclusive video feature on the Crux website. We post these from time to time, so keep checking our YouTube page. We always try to bring you the best in Catholic conversation. Until we see one another again, this is John Allen, the editor of Crux. For the entire Crux team, we will talk to you again soon.